So a cystic fibrosis patient considering a career option, there's a few things to think about. They want to think of how it's obviously going to affect their health. Is there going to be still time in the day for them to do treatments? Are they going to have one of these so-called 9-to-5 jobs that they're going in before the crack of dawn and leaving last person to leave at nighttime, which obviously everyone wants to strive in their job, but sometimes they have to be realistic if they want to stay healthy. Are they able to have a break, to have a snack, or even to have lunch? Not even necessarily to go out to have lunch, but able to bring food into the workplace and to be able to have time to eat that. Is this a job that offers or has available family medical leave and sick leave, and how do they work with other employees? The other thing to work for is just the quality or the conditions of the environment that they're working in. A lot of this is talking with your team and figuring out what you want to do and what that means to your health and how you can still achieve what you may want to achieve, but how we can kind of help you to either guide you or work with that decision.
Jeff Breslin, I'm 29 years old. I work for the Cal Ripken Senior Foundation, which is a nonprofit in Baltimore. Went to York College. My degree was in sports management. This is actually my first job out of college. I've been there for 8 years now, and actually did an internship in college with the organization. Went back, finished my degree, and they asked me to come back and haven't left yet. For me, when I was trying to figure out what I wanted to do, what career I wanted to pursue, to say that CF didn't have, play some role, it just wouldn't be true. It did in some sense. When I was younger, I thought at a time I wanted to go into law enforcement, but there's a sense of reality. When you have cystic fibrosis, you have to understand whether you like it or not, there's a reality to it. So it did play a role in what I wanted to do. Having the internship was extremely key for me because it gave me a sense of what's it like to be in the professional world. What are the demands of a 9-to-5 job? And then how do you manage CF with that? Because of the internship, I knew what I had to have in a job, or the type of career that I had to have that allowed me to, to be able to still manage my CF, but then have a successful career.
Well, I'm a third grade school teacher, so I would imagine that when I told Dr. Boyle and Dr. Rosenstein that I was going to school to be a teacher, inside their stomach was going up in knots. But there's 3 components to being healthy: that mind, body, and spirit. Yeah, your body does have to be healthy. If your mind and spirit aren't healthy either, the balance is all thrown off. I have known since teaching swim lessons that just working with children gave me so much intrinsic reward inside, that just that positive energy going through my body helped to make me healthy. So I do go to school every day, where I have 26 little germs all around right here. And we are Lysoling our desks every other day. We're using hand sanitizer. But the positive energy that I get during those 8 hours of work, the uplifting energy that those students carry into that classroom, smiling every day. Now at 3 o'clock, I'm okay that they leave, but that next morning I'm ready for them again.
I work currently at a company where I have a nice desk job. So I'm in a building during the day, mostly dealing with paperwork. I did complete 4 years of college, graduated with a degree in hotel restaurant management, did that for about 5 years, and then ended up kind of changing career paths a couple times, ended up where I am now.
I'm a lawyer and I work for the federal government, the FDA, Food and Drug Administration. So I actually started out studying science. I've always been fascinated by biology, and when I was in college, it just made sense, I think, because of having health issues. I just wanted to know all I could about it. Then I got out into the work world, and I was not quite sure how I wanted to make that fit. I didn't really want to work in a lab. I did end up working initially for the Cystic Fibrosis Foundation, so I felt it was a nice fit for me to be able to advocate about the disease. At the same time, I realized I wanted to go back to school to get a more career-focused degree. So I ended up going back to law school. I did do this at night and worked part-time at the CF Foundation while I did this. And I really enjoyed actually having the combination of my knowledge in science and healthcare as well as my law background now. And so that's enabled me to work at the FDA as a regulatory counsel and to understand more of the science that is so important at the agency.
To learn more about this issue, ask your CF Foundation Accredited Care Center or contact the CF Foundation directly. Call 800-FIGHT-CF or email us at info@cff.org.